Good evening, everyone, and welcome to episode 7 of the Wave Contact Lens System series, presenting Troubleshooting Myopic Orthok, best done before starting the case by Dr. Ken Mahler. Before we get started, as always, you can answer or you can ask questions at any time by entering questions into the chat box on your GoToWebinar screen, and we'll go ahead and address those at the end of the presentation. We are really only going to answer questions that are on topic, but off-topic questions do guide future presentations, so don't hesitate to ask any sort of question you may have. Finally, this presentation will be recorded, and there will be a recording available on the WAVE website following the presentation in case you missed anything or if there's anything you want to review. Dr. Mahler, take it away.
Thank you, Carver. Good evening. Welcome. Thanks for coming out tonight to this particular webinar, number 7. We're going to be doing Troubleshooting Myopic Orthok, and that really is best done before we start the case so that you know actually what kind of trouble you're going to be getting into. All right, let's just move on here with some housekeeping. I do consult for both Oculus and Wave. I am a private solo practitioner in Fort Lauderdale, and the practice is centered on contact lenses pretty much 100%, and mostly dealing with irregular corneas. Any normal corneas are pretty much in Orthok. I did previously do the national clinical support for WAVE to help cases to be brought to fruition when they did not go so well. And I've also done some lectures and webinars for WAVE users through formal lectures. In addition, I do offer private practitioner consultation services, which I'll talk about at a slide near the very end, which does provide case-by-case help or one-on-one training, phone, in-person, remote fitting, and all through telemedicine. And I do beta testing for the software, both the CSP and WAVE, as well as I'm currently doing the hardware testing for the Pentacam AXL WAVE. I did author the first WAVE Designers program, and I'm currently guiding the WAVE training in addition to doing these webinars. The webinar schedule tonight is the second one down there, Troubleshooting Myopic Orthok. And the next one is scheduled tentatively now for the 10th of May, and that's going to be on corneal GP wave basics, simple to complex corneas. I think we sometimes forget that corneal GPs do have a role in clinical practice, and so we do want to get wave in there and applied there because it really is a fantastic clinical tool to be able to have at your fingertips. All right, let's get started tonight. Tonight is really going to be about a case. This case started well before I saw the patient, and so this is a little bit of where this case actually began. In the upper right there, you can see this is office visit number 1, and this patient was examined on the 2nd of January in 2013 at an institution. It's an 11-year-old male Asian from highly myopic parents. The refraction at 11 already was over 5 diopters of myopia, as you can see there. The patient was fit with another Orthok system. This was not WAVE. And the parameters that I have here were taken directly from the chart. So I know that the base curve was 920. With a 10.5 diameter on the right and a 910 with a 10.5 diameter on the left. And that pair was dispensed on the 19th of January. And the remainder of the exam was non-contributory. So the 119 was the second visit, and he received lens for the right eye, number 1, and lens for the left eye, number 1. Okay, the corneal topography taken on that date, you can see, was done on the Medmont. And the right eye is on the left side, the left eye is on the right side, and I'm pointing that out because I just grabbed these pictures from the chart and sometimes they have the right on the right side, sometimes it's on the left side, so you have to actually pay attention to how they actually display these on the chart. Okay, third visit, OD number 1 and OS number 1. This was after 1 week of treatment with the Ortho-K lenses. There was no notation for the uncorrected acuity, but a refraction was done that day, and you could see he's about -1 undertreated with the 20/20 endpoint with that in place. The assessment written on the chart was that the right lens was slightly superiorly decentered, good treatment zone, adequate reverse curve depth, but small superior and inferior bubble, adequate peripheral alignment. So I'm assuming this assessment was actually done because they put the lenses on the patient to take a look and see what the lenses look like. The left one, slightly superior decentered, also good treatment zone, adequate reverse curve depth, adequate peripheral alignment. And the topography shows inferior steepening consistent with high riding lenses OU. Central flattening, paracentral steepening consistent with good treatment 1 week Ortho-K. Now, when I see the notation inferior steepening consistent with high riding lenses, I'm thinking about a smiley pattern type of topography. And if we take a look at the topography, I'm not really sure why it was notated that way. I do see the inferior reverse curve is considerably steeper down at the bottom, and on the left eye, which is on the right side here, we could see that the reverse curve is kind of bleeding out inferiorly a little bit steeper, but I don't know that that's actually a consistency with a high riding lens. Anyhow, at that point, the patient was RX focused dailies for day wear because he was 1 diopter undercorrected, and they gave him 75 diopters in the dailies to get him by, and then recheck 1 week. Okay, at the 4th visit, he's wearing OD1 and OS number 1. So this is 2 weeks of treatment with Ortho-K lenses. The patient states the vision in the right eye is poorer than the left. And the right eye frequently itches. The VA uncorrected was 40+2 in the right and 25 -1 in the left, so that certainly goes along with the patient's subjective report. The refraction, that sort of goes along as well, where he's under by 3/4 diopter on the right eye and only 1/4 diopter on the left eye. Topography that day, we could see now that the left side is actually the left eye and the right side is the right eye. And once again, that left eye has that somewhat bleeding out reverse curve zone of a little bit of steepness there. And the right eye looks like it's fairly close to the position of the pupil. If anything, it's a little low. So at that visit, OS treatment better compared to OD treatment. Topography of 2-week Ortho-K treatment shows inferior steepening consistent with slightly high riding lenses OU. Central flattening and paracentral steepening consistent with good treatment 2 weeks post Ortho-K treatment initiated. So the plan at that time was recheck another week later and to continue with those current lenses. He was now given some more focused dailies for the right eye only with a -0.5 diopter power to get him by when he was in need of that. And then there was also the comment here that they were going to possibly call a consultant to reorder the right lens to decrease the reverse curve depth due to a bubble. And again, I'm assuming the bubble had to do with what was assessed when they put the lenses on at the institution. At the 5th visit, he came in wearing OD and OS number 1, and this is 3 weeks of Ortho-K treatment. Patient state lenses are uncomfortable and vision decreases by noon. Uncorrected vision after 3 hours, we could see the right eye is not doing very well at all. He's at 20/80, and the left eye is at 20/40, so that's not very good either in terms of his uncorrected function. Refraction that day was -150 in the right and about -1 in the left. Topography that day, the left side is the right eye and the right side is the left eye. And again, we can see a little bit better formed reverse curve, but it does appear to be relatively well centered on the pupil that's indicated on the Medmont topography here. Assessment. OD, central island of steepening with paracentral flattening and mid-peripheral steepening. OS, central flattening, paracentral steepening. Continue with current lenses until new lenses arrive. The new lenses ordered within the same design, but they decreased the diameter down to 10.0. And the base curve has changed now to 9.30 and 9.20. And this was the second pair dispensed on the 21st of February. So that was the 6th visit with OD number 2 and OS number 2. For the 7th visit, he came in wearing OD 2 and OS number 2. He's 4.5 weeks into treatment with Ortho-K lenses. And the patient reported that the vision had actually improved with these new lenses. After 1 hour of removal, he's 20/70 and 20/50. And so it still doesn't look very good to me in terms of his uncorrected vision. And this is actually only 1 hour after the lenses have been removed. Refraction still shows about 1 1/4, 1 1/2 diopters undercorrected in the right eye and about 1 diopter undercorrected in the left eye. So that doesn't seem a whole lot different objectively on my side, that much is improved from that first pair of lenses. On the topography, we can see here, again, now the left side has the left eye and the right side has the right eye. We can definitely see that the right eye is undertreated. And the left eye is not looking very good. It looks like it's almost something of a double ring there that's starting to form. It's a little bit tight on the nasal side over there. And so this does not look like an improvement to me over the first treatment topographies from that first pair of lenses. The assessment, OD and OS, central flattening with paracentral steepening, well-centered treatment zone. The yellow question mark is mine because it does not look like a well-centered treatment zone to me. Improved comfort, fit, and uncorrected vision. Well, again, that yellow question mark is mine because they didn't comment to me about the comfort, but from the fit and the uncorrected vision, that didn't look like it was really improved to me. Continue with the current lenses and recheck 1 week. So at the 8th visit, wearing OD number 2 and OS number 2, he's 5.5 weeks into Ortho-K. Patient reports OD foreign body sensation this morning with tearing and photophobia. This says his vision was corrected, but I'm not really sure with what. I don't know if that was with the contact lenses that they just put on and took an acuity with those contact lenses on, if it was a pair of glasses. I have no idea what they actually used. It just said it was corrected acuity, but it was best at 20/40, only pinholing to 20/25 in each eye. The biomicroscope showed the right one remarkable for a 2 millimeter round epithelial defect inferior temporally, just outside the visual axis, no infiltrate, no anterior chamber reaction, negative side L's sign. The left one was unremarkable. We take a look at the assessment. He has an abrasion on the right eye, secondary to the contact lens wear. He was instructed to discontinue all contact lens wear until the follow-up in 2 days. They treated the right eye with scopolamine in office, gave him a sample of moxiza, that's moxifloxacin. They didn't give a dosage, so I'm not really sure how often he was supposed to use that. And he was returned to clinic 2 days, and he had the emergency contact number if anything had gotten worse. So he came back 2 days later for his 9th visit. He's 5.5 weeks into treatment with his Ortho-K, and he reported that the ODI feels fine now. He used the medication as RX'd. Again, he's corrected, but I don't know exactly what they corrected him with. It's possible that they just put the Ortho-K lenses on and took that acuity, but he was 20/20 -1 and 20/20 with that. The abrasion was completely resolved. They discontinued the antibiotic and resumed Ortho-K, and you check him back in 3 days. His 10th visit, wearing OD number 2 and OS number 2. He's 6 weeks into treatment. He reports the right one is unable to focus up close, and the right one has double vision. 1.5 hours after removal, we could see we're back at around 20/40 uncorrected acuity, pinholing to 20/20. Interestingly there, though, the right eye sees better at close than the left eye, despite the subjective report that the right eye had trouble seeing up close. Refraction, Again, he's undertreated, 3/4 diopter and 1 diopter, respectively. And there was a comment about this vertical linear staining temporal on the right eye. So topography shows right central island with inferior paracentral steepening, superior decentration with inadequate applanation of the treatment zone. The left showed the paracentral steepening with inferiorly with superior decentration. Again, related to the pupil, it doesn't appear that the treatment is actually superiorly decentered. Once again, now the left side has the right eye and the right side has the left eye. We could definitely see the undertreatment there on the right eye. And they do comment about this central island, but I'm not really sure where the central island is because I don't really see it on that particular topography. Continuing on that day, decentration of treatment OD and OS. Patient continue with the current Ortho-K lenses till new lenses arrive. Patient advised to use adequate lubrication on inserting lenses, re-instructed on proper insertion and removal technique, and advised to discontinue lenses if experience any pain on insertion. So at his 11th visit, he's still on OD number 2 and OS number 2. The history, nothing was noted. No uncorrected acuity was measured. Topography was taken that day, and they evaluated these lenses from stock. Again, we're back up to 10.5 millimeter diameters, and now we're at 920 millimeter radius of curvature on the base curve. This is the third pair, and I guess they didn't really like the way those look, so they ordered an additional pair, which was the fourth pair, flattening out the base curve a little bit more, but leaving the diameter at 10.5. This was the topography on that day. Okay, at the 12th visit, he's now on OD number 3 and OS number 3, and he's had 10 weeks of treatment with Ortho-K. He's worn those lenses since 3/16, so it's about 3 weeks later on the third pair, but vision is poor in both eyes. Uncorrected acuity is 2200 and 2400, so I would agree that the acuity was actually pretty poor. Dispensed a new pair of lenses, which was the fourth pair. Those were the ones with the flattened base curves on both that they had ordered in. He was instructed to leave those lenses on and wear them into the appointment that was going to come up in 1 week. So that was the 12th visit, OD number 4 and OS number 4. At his 13th visit, 10.5 weeks out of treatment, he awoke with the right lens off center in the corner of his eye. 2 hours after lens removal, he's 2200 in the right eye, pinholing only to 2060, and the left eye is 2060 minus with a pinhole only to 2040. Refraction, minus 450, that's almost untreated. That's about where he started. He was only about a -5 myope. And the left eye is about a -3 myope, and that really wasn't reported as anything eventful. So I'm not really sure why that was so under treated. The comment there was that the topography showed incomplete effect, but no signs of significant decentration. The patient was instructed to continue wearing the fourth pair of lenses and returned to clinic about a week later to attend an Ortho-K workshop for a second opinion from another consultant. This was the topography of that right eye that day. Okay, so at the 14th visit, he's on the fourth right and fourth left lens. He's been 11 weeks into treatment with Ortho-K. And he does report that the vision is better, but still worse in the right eye than the left. This is the first time we've actually seen uncorrected acuities somewhere close to where we're trying to actually get to. He's 20/25 minus in the right and 20/20 in the left, 6 hours after the lens removal. And then he attended this Ortho-K workshop for a second opinion. The second opinion physician had commented that the right eye had a 2.5 millimeter center zone, not enough touch centrally, not enough edge lift, and decentered nasally. The left was decentered inferior nasal, and it had a small treatment zone. The topography that day, you could see on the left side is the right eye, and that is significantly decentered. And then the left eye, Again, it's not great, but it's not awful. But it does have a very central, a small central treatment zone. So the assessment that day was myopia OU. The workshop was completed successfully. Habitual lenses fit flat today, causing lateral decentration with inadequate treatment zone. And so the plan was decided to keep the patient out of lenses for a couple of weeks to allow the cornea to normalize. At that follow-up visit, they were going to focus on centration of the lenses first and then the treatment zone secondarily. The starting point is going to be 920 and 10.5 diameter and a 910 and 10.5 diameter, which is a repeat of the first pair of lenses that he actually had started with at the beginning of this, what was it, 11, 12 weeks earlier. So at the 15th visit, he's now 13 weeks out into Ortho K. He has not been wearing any lenses for 2 weeks. He's here for a dispense of some new Ortho K trial lenses. Evaluation of the lenses shows questionable treatment zone radius and centration, inferiorly displaced when lids are lifted away. However, when the lids were put into the normal position, adequate treatment zone, centration, and edge lift. The new Ortho K trial lenses were dispensed today. Recheck 1 week for follow-up to reassess adequacy of the treatment zone and centration using topography. So this is a repeat of the first pair, so he's back in the very first pair that he had started with at his 15th visit. A 16th visit, he came in wearing the first right and first left lenses. He's 14 weeks into treatment with his Ortho K lenses. He's been wearing these for a week. 10 hours after removal, right eye once again is a little more undertreated than the left eye at 20/50, and the left eye is at 20/30 uncorrected. And again, we're back at around 3/4 diopter, half a diopter of undercorrection, which is kind of how this case started at the very beginning. Topography, very, very similar to the way it looked at the beginning of the case. And so the plan now was that the left Ortho K lens was dispensed from the stock, but they found one with an increased reverse curve depth, and they apparently did not have a similar type of lens for the right, so they ordered a new right lens with an increased reverse curve depth, keeping the base curve and diameter the same. He was going to come in for that new right lens when that one arrived. So at the 17th visit, he has OD number 5 and OS number 5. This is in June. They dispensed the right lens, and he continued wearing the left lens from 5/8. And so these are the 5th pair of Ortho K lens that he has now, both having the increased reverse curve depth. Come back in 1 week. So he's at his 18th visit, 5 lenses into each eye. He's had 19 weeks of treatment with Ortho K, only 1 week though on this new right one, but he's been in the left one for 5 weeks now. Patient reports adequate vision, right eye not as clear as the left. He's 20/40 uncorrected in both eyes, 10 hours after they came off. And the refraction, once again, is about a diopter undercorrected in both eyes. Topography shows OD central flat island with moderate paracentral elevation. Expect increased flattening with further wear. OS central flat island with moderate paracentral elevation. Expect increased flattening with further wear. And so the assessment that day is compound myopic astigmatism, OU Ortho K with adequate vision. Expect slight VA improvement. Discuss patient findings and to continue with current Ortho K lenses at this time. Return to clinic in 3 months for follow-up at PRN. So here he's got uncorrected vision of 20/40, and he's really being dismissed for 3 months. So the summary as of June was this is his 18th visit to the institution. He's 19 weeks of Ortho K treatment, which is over 5 months. I didn't comment, but his brother was going through this simultaneously with equally poor results as well. The brother was a little younger and just a little less nearsighted than this fellow here. Patient continues to complain about poor vision. He's on his 5th pair of Ortho K lenses. 10 hours after removal, he's at 20/40 uncorrected. He's about 1 diopter undercorrected. and he was told to continue with these current lenses and regimen and follow up in 3 months. Father told to expect some improvement in vision with this last pair of lenses over the next few months, since the doctor was now satisfied with the fit. So the question is, why did this case go so poorly? What were really the problems as to necessitate 5 pairs of lenses, an abrasion, finally arriving at a pair of lenses giving him uncorrected acuity of about 20/40, undertreating him by about 1 diopter? Was it the initial RX? What about patient non-compliance? Wear time, maybe he's not wearing it the right amount of hours or too many hours. He's not taking proper care of the lenses. Is it the solutions he's using? What about his application and removal technique? Maybe it's poor wear. Maybe he's a stomach sleeper. He's got strange sleeping patterns, etc. Poor motivation. Well, I think we can rule out poor motivation, as 18 visits to the institution would indicate that he was plenty motivated. Tear film. Tear film didn't look really very bad. What about the corneal shape? Diameter, was it unusual? The cylinder distribution, etc. Was there something unusual about the corneal shape? What about the initial topographical data? Maybe that data was flawed. Poor lens design. Well, they went through 5 designs along with 2 different doctors looking at the case, trying to come up with a good lens design for this particular patient. So at the end of July, 25 weeks of Ortho-K treatment, the mother brought the patient to see me. So this was actually when I met the patient, 6 months after he started Ortho-K. Frustrated with the son's Ortho-K results. The patient continues to complain of poor uncorrected vision. The left eye is fairly uncomfortable. In speaking with the mother, I determined that the patient only discontinued this last pair of Ortho-K lenses 3 nights ago out of frustration. And so I explained to the mother that I really wanted him out of the lenses for at least another 3 weeks before addressing him with Ortho-K, because I really wanted to get good virginal topographies on him. He was to wear his spectacles in the interim. First visit with me for treatment was at the end of August. Spectacle only wear for 4 weeks. Spectacle VA was fair. They're 1.5 years old. The RX, again, he's about a -5 myope. A little bit of cylinder with the rule there. And yes, he's a little undercorrected at 20/30 minus. I refracted him that day, and you can see it's not really a lot different. Slight change on the cylinder axis there, but that did get him to 20/20 minus. Remainder of the exam is non-contributory. And let's take a look and see what the topography looks like. So this was the topography that I did that day. And as I had talked about in an earlier webinar, one of the first things I will do is do my on-screen pen test. And so here's the vertical, and taking a look at the left and right sides of that line, how much does the left side of the cornea look like the right side of the cornea? And we could see that they look actually fairly symmetrical from left to right side. But top to bottom, they really don't look very symmetrical. We could see that it's a lot steeper down at the bottom than it really is at the top. And just for comparison, here are the Medmont ones, and we could see the exact same problem on the Medmont topography right at the beginning of this case. And so that inferior apex of this cornea really was not properly identified at the beginning of this case. So taking a look at the elevation, you can see here on the right, I have a best fit sphere, and down in the lower left is the vertical cross section of that elevation. And take a look at the roughly about the 3 millimeter chord over there. We could see that on the left side of the graph, we're up probably just approaching about 20 microns of elevation. And then on the right side, we're down at about 20 microns of elevation. So we really do have an elevation difference from top to bottom that's different by about 40 microns. If we take a look at the left eye, very, very similarly, if anything, we can see that this is actually even greater in terms of the asymmetry from the top to bottom, and that was reflected by my pen test on the screen there, where you could see that the bottom is considerably steeper than the top and it's more elevated. And here we can see, once again, on the left side, we're down below the 20 micron line, and on the right side, we're approaching the 20 micron line. So again, about 40 microns of difference in elevation between the top and the bottom of this particular cornea. These are the wave lenses that I designed for this fellow. And I measured the cornea at 11.8, and unlike the 10.5 or the 10.0 lenses that were done before, I went to 11.5, which was just about, greater than 95% of the corneal diameter. I designed up a central spherical treatment zone, but I did design up a freeform periphery, and that was to deal with that asymmetry that was along the vertical meridian. I also, in the left eye, created a shorter vertical treatment zone that creates basically an oval shape to better deal with that vertical asymmetry, because I was a little concerned that the left one was even greater than the right, and that might create some issues. Now, it's hard to see that on this screen, so what I went ahead and did to address that 40 micron elevation difference between the superior and inferior periphery on each eye is these are the back curvature maps of those respective lenses, with the right one on the left and the left one on the right. And you can see on the left back curvature map there, you can see that the treatment zone is a little vertically squished. That was so that I can get that to better align out in the periphery and deal with that asymmetric elevation difference that was out there. Once again, on the right one, you can see that, but I did keep it as a spherical treatment zone. I didn't feel it was as necessary on the right eye. Moving on, the second visit, this was my dispensing visit. Uncorrected acuity was 2400. I placed the lenses on, and my protocol is a little bit different than is generally done throughout the industry. I do apply the lenses, have them sit with their eyes closed in the chair for about 2 minutes, just with their eyes closed gently. And then I will guide them into the biomicroscope so I can take a look and see what the lens looks like as soon as I open the lids. The right and left look both well centered with good bearing and alignment zones. I then will bring them into another room to lay down, just basically a recliner chair, lay down for 2 hours with his eyes closed. Some of the kids will actually go to sleep during that time. I then brought him back into the exam room 2 hours later. The right and left were freely moving. The right just slightly low of center. The fluorescein pattern looked good. There was no staining and there were no microcysts. I removed the lenses, and his uncorrected acuity was already at 20/20 minus after just the 2 hours of treatment. My assessment was that the treatment was well positioned, but there might be a little concern with that right lens dropping slightly low of center. Excellent visual result, ODOS. My plan was I trained them up on how to get the lenses on, off, and how to properly take care of them. I was using Optimum Extra Strength Cleaner for daily cleaning at the time. Softlawn, which is a hydrogen peroxide system for daily disinfection, nightwear only, and I checked him back 2 weeks later. So at his third visit, he's on right lens number 1 and left lens number 1. He's 5 weeks out. He didn't quite come back in the 2 weeks. I'm not really sure what happened there, but he came back about 4 weeks later. Nightwear only, comfort's good, vision's very good the entire day. He's doing great getting the lenses on and off. He had reported no problems whatsoever. Lenses off for 1 hour. He was 20/20 in the right and 20/15 minus in the left, which is in fact even better than he was corrected best spectacle correction at the initial exam. Manifest refraction, basically dead on target. He was plus a half, minus a half in the right, plus a half, minus a quarter in the left, both getting him to 20/15 acuity. And then nothing unusual at the biomicroscope. Topographies that day, you can see well-formed reverse curve, good central treatment zone. My assessment was good fit, good uncorrected acuity, continue nightwear only with the current pair, recheck 5 months later. These were the difference maps from that day, from the right on the left side and the left eye on the right side there. And you can see everything looks very, very nicely positioned, nicely centered, nicely treated, a good reverse curve. So summary of troubleshooting. Ortho-K is really the real estate of eye care. It's all about location. You must get the lens to sit where it needs to sit. Otherwise, you're dead in the water in terms of giving proper correction. The multiple Ortho-K failures in this case were likely due to the inferiorly decentered corneal apice. Now remember that the outer 1/3 of the lens is responsible for positioning, alignment, for proper balance of those hydrodynamic forces. In wave, this is very easy to visualize, and you can control that with the design. In this particular case, I did it with a freeform design. If you're not able to create these types of asymmetrical designs, dealing with these asymmetric corneas can be anything between frustrating and impossible to bring to success. Long-term follow-up. Due to college and COVID, he missed appointments between March 2019 and the January 2022 exam. That was just 3 months ago that I saw him. But he's now been in Ortho-K for 9 years. He's 20 years old now, doing great in college. And because he missed those appointments, his lenses actually were 3 years old. So they were a little beaten up, yet uncorrected acuity, 20/20 and 20/20 minus. These were the maps from that day. So despite the fact that the lenses were kind of beaten up, he's still doing actually exceptionally well all these years later. So to summarize, we have these resources available for you guys out there. These are my personal resources, and down in the lower right there is the web address where you can find these. And I do offer 5 different options. Advanced learning for non-FDA, elevated complexity, anything that's beyond the waves, help desk, etc. And my first option is case-by-case help. So that's primarily when a case really hasn't gone well. You can learn as you go, as the case presents itself to you. So for example, you take on a case and the case has not gone well, I can bail you out by taking over the case, and you can learn in the process. The second option is phone help per time unit. Typically, they target very specific cases to bail out a specific case. So you're mostly doing okay with that, but you don't really understand why something's not working. And we can discuss that by sharing screens online and then discussing the case in real time as to what needs to be done to fix the problem. One-on-one personal time, that's pretty much a full targeted session, either 1 or 2 full days that are directed at specific weaknesses of the doctor, as well as the goals of what the doctor wants to accomplish. Design and supply are primarily for non-wave users. That's where I'll do the case for a non-wave doctor and supply them the wave lens. And the very last thing are the DVDs that were recorded from the Wave Winter Weekend workshop a few years ago, which is approximately 16 hours of index material over 8 DVDs. It covers a robust range of theoretical concepts and clinical applications for wave, Ortho-K, Sclera lenses, irregular corneas, etc. And you can find all of that information at that web address. From Wave, we have the wavecontactlenses.com site, and on there is the page for clinical support. The concierge lens order service, where you don't really want to learn what needs to be done, you just want the lens designed for you, and that's taken care of by the staff at Wave. The user guide, the Wave Academy can be found there, technical support, and also the link to iOS to see your orders. On the resources page, there are these webinars, the videos, and events that are coming up. And then, of course, there's the Wave Users Google group that is the emailed discussion forum to discuss all these various cases that are, handled as a peer-to-peer advice, through these topics and that come up and arise, and you want a little help from other Wave docs, you may be able to post things there and get some help from some other docs. And with that, that's going to conclude tonight's webinar. And Carver, you can take that away with some questions.